Hello everyone. My name is Denise, and today I have Martin, my friend and a fellow private practitioner, counselor.
Hello, everyone.
Hi, so Martin, would you like to give us a quick introduction of yourself?
Okay. I'm well. I started off as a special education teacher many years ago, and generally, I moved from being in the disability sector to working with persons with mental health concerns. And one of the things that I thought would be uh, that attracted me to working with persons with mental health concerns is I guess it's a dire need, lah. The realization that there are a lot of people out there, yeah, who tend to, have this challenge in this day and time, actually, in this age, in seeking out a therapist or a counselor or even a psychiatrist or both. Yeah, because like in Singapore, right? I mean, I find that there are not many people out there who are able to provide uh, such a service. What I mean by this is that there are very few therapists, counselors, and even psychiatrists actually. Sometimes you can count by your fingers, by your fingertips as to how many psychiatrists there are in Singapore. Yeah,
I
yeah.
was
So
just,
that's why I thought maybe why not? Yeah, I don't know. What do you think, Denise?
yeah,
Yeah.
I agree with you. I think that there's a great need. There's
Hmm.
a great need for mental health practitioners, even like counselors like us, like you and I, that focus on mental health issues, but also for people with adjustment disorders, like just like a really big crisis pump in their face. How are they gonna deal with it? Having a short-term therapy with a therapist really helps. So there's a great need for that. It's just that I feel that there's not a lot of uptake. People tend to go for various ways of treatment. Some maybe they book a good holiday, they go overseas, or some go for a good massage. Okay, massage therapy, I think that's
Yeah,
actually
yeah.
legitimate. But this kind of talk therapy that we offer is not really so mainstream at this moment. But I think that with more of us coming up and providing this service, it can really have a good ripple through society. What do you
Yeah,
think?
that's right. That's right. I mean, I think it's catching on in Singapore. The one thing that the virus that gave us is the realization that we all need, you know, always that moment for someone to talk to. I think in Singapore, right, basically, if you look at it, in the past, when we talk about counseling, right, or reaching out to people with who need professionals, way back, many of in fact, even until today, actually, right, that people tend to resort to going to see their, for example, temple mediums, the Malay community, they have your bomos, what else you have? Of course, you have your priests and so on. That's the first thing that they would do if they see that there is something amiss or a change in a family member's behavior, for example, if they see their son or their daughter becoming or has become very withdrawn, so they get worried. They thought, oh, is this demon possession, or a spirit has entered the person? So the first thing they go to is someone who is their talisman, or someone who is in the spiritual realm, lah. You know what I mean?
I
Yeah,
know, I know.
yeah, that's right.
Um,
So
yeah.
yeah, you're saying, yeah, carry on,
Oh,
carry
sorry. I felt like I interrupted a really good
on.
train
No, no,
of
no.
thought. But I was just thinking that counselors and psychologists were like the modern day priests, the modern day doctors and modern fortune tellers. Like we so called
Yeah.
fall under that archetype of wise old man or wise old woman. It's
Mm.
not common. It's not uncommon that some clients come to me and think that I'm some sort of a fortune teller that can tell them the future. It's quite funny.
Yeah.
And also, no doubt, the spiritual element is one part of like good health, right? You need to have good physical health, good emotional health, maybe even good spiritual health. It's just part of that different aspects of health. So in the past, like you mentioned, people tend to attribute it maybe almost like a knee-jerk reaction to a spiritual cause. So they will
Mm,
go to the
mm,
priest, to the
mm.
bomo, to the fortune teller, or to the temple medium.
Yeah, lah. That's right, that's right. And then temple medium, will, of course, or their bomo will give them, maybe a piece of paper. They will burn the piece of paper. You drink the ashes, and then in modern day times, you may say that this is like a placebo effect. I mean, then they feel better, but actually, it's just a placebo effect. Yeah. So for today, right? I mean, I guess that like what you mentioned, Denise, that Bomo or that temple medium or the priest, has been replaced or is slowly being replaced by your therapists, your counselors, and of course your psychiatrists and so on.
No, I wanted to
Uh,
add this. Sorry for the another rude. I was thinking, okay, so I'm also serving at a church right now as a counselor.
Yeah.
So I realized that it is not entirely true that we are at 100% replacing the priest, because there are a lot of people who still go to religious sources for help
Yes,
in
yes,
times
yes,
of
that's right.
distress, especially things with like maybe death anxiety. They don't know what happens after life, like existential issues. Then they
Mm,
might go to the priest. So it's great because now I work with the priest. The priest, they take care of the spiritual aspects. So if there's possessions and all that, they can do the exorcism and all that. Then I will listen to the psychological aspect.
oh, wow.
So
Okay.
there is some kind of a synergy there, and I quite
Mm,
enjoy it. And as I'm talking to the clients, to tell me, well, it's between seeing a priest or a psychiatrist. It's quite funny. They even them, right? They could be really young. They already know in their mind, like psychiatrists, priests, counselors, psychologists. We all fall under the archetype of the helping profession, the wise old man or wise old woman.
mm.
Okay, before I rudely interrupted, what were you trying to say?
Ah, I lost my train of thought.
Anyway,
No
before we
worries.
go too
I
deeply in
think,
this
yeah,
topic, I
yeah.
wanted to ask you more about yourself.
Oh, okay, okay.
I'm
So
so curious. You used to be a special needs educator.
educator lah. Yeah, that's right.
So are you actually familiar with things like autism?
Oh, in those days, we yeah, I hope I don't sound so old, but in those days, we never really dwell in this area of autism. Partly also, primarily also because we were not so familiar with it. In Singapore at that time. This was way back in the 1990s. Yeah, so autism only came to light in Singapore, if I'm not mistaken, I think in the later part of the 1990s. Although there were special schools by then, catering to the needs of children as well as youths with autism. Yeah, but
Mhm.
it was still something that's very new to us. So if we talk about adults or children or youths with developmental disabilities, cerebral palsy, uh, you know, um, and then you have global delay, and so on. And it's great to know that now, as you can see, there are more special schools. There's a lot more recognition, right, for these special populations and so on. And when we talk about mental health also, if you talk about mental health, it's the caregivers or parents, caregivers, even siblings who eventually become caregivers of their siblings with special needs. I think the stress level is tremendous. Like once someone told me that if you are a parent or a caregiver or someone with a special need, it's perpetual crisis actually. You know what I mean?
I know
Because
what I mean. I know what I mean because I have
uh,
one particular client who's also was looking after his wife for many years, and
mm,
then she had some kind of special needs, like we can just broadly speak. And it's like he tells me that it's like one problem after another. It's just like dealing with one fire after another. There's no pausing to
no
think about
end, yeah.
long-term goals, and then it's just him with his wife. Well, I tell you, I have great admiration and I'm very impressed by him to this day. But
Mm.
it seems like you have a heart for caregivers. Would you like to tell us more about that?
Well, I mean, I think looking at parents, looking at siblings as well, because I work with adults as well with disabilities and so on. I think one of the things is that basically the burnout, the burnout issues.
Mhm.
That's one. lacking in also the other thing is also the lack of support lah. Yeah, lack of support from maybe family members. There's a lot of this blaming thing, you are at fault, you are the one who caused this. And that sometimes can lead to couples getting a divorce. Yeah, it's very real. These are very real issues. Yeah. And then of course, besides this blaming thing, and there's also again here, because we are so Asian, I mean, we come to the spirituality of it. Yeah, there's always this some, not all, that that something must have happened in the past that got you to this point where you have a child with a special need. So again, here is also about the besides the blaming, it's like who's at fault here again.
Gosh, when
Yeah.
you say that, I sort of feel quite saddened that it's already such a, I don't like use the word burden. It's just such a great load to carry looking after a special needs child, and now you are, given guilt and shame for it as well. That's horrible. Is it okay if I go on a tangent and ask you something else?
Yeah, sure, go ahead. Yeah.
I remember that you told me that your favorite modality is solution-focused brief therapy. So
Mm.
this is your chance to rave about it. Why do you like SFBT so much?
Well, I SFBT primarily focuses on the solution, yeah, and not the problem. So, I strongly believe that sometimes, not that we hide the problem or not that we brush the problem aside. We do recognize, or I do recognize the problem that, I mean, when clients come to me for therapy and all that, the most important thing is we need to shift sometimes to look at the solution. Yeah, because you can resolve a matter not by looking always at the problem, but by actually looking at the solution. And in solution focused behavior therapy, we always believe that primarily that there is a solution in all of us, no matter how challenging or no matter how difficult your your issue is, or your problem is, but there's always a solution. So the question now is, what solution focus, which is evidence based, yeah, how they have actually crafted questions and techniques, yeah, over years of research, and I think it's still evolving anyway. Yeah.
What are some of your favorite questions in SFBT?
Oh, one of the favorite question is basically, what do you notice about yourself? Or what do others notice about you? Or one of the simplest questions, which is only 2 words. What's better?
I love that
Yeah.
question. What's better, right?
It's
That's
very simple, no?
yeah.
What's better? And straight away you see the client shifting straight away. Oh yeah, what's better? Okay, so this happened, and I managed to, for example, I managed to sleep earlier, maybe by half an hour, maybe by 1 hour. In the past, when I had clients who have very serious sleeping issues, and we work on these things, yeah. And they would sleep at 4 a.m. in the morning.
Mhm.
I had a client before, if I may recall, she used to sleep at 6 a.m. And it's interesting that we and and we work towards her sleeping maybe at about like 4 a.m. or 5
Martin,
a.m.
as you're talking about this, the concept of baby steps like sort of pop into my head.
Yes,
Like
correct.
don't try to make drastic changes. If the person wants to sleep, like maybe at 10 p.m., that's the ideal. But now she's sleeping at 6 a.m. We baby step first, maybe to 5:30, next to 5 and 4:30. So you ask what's better, they can say, yeah, that's better. I slept half an hour earlier, and that's actually something that's
Yeah.
worthy to be noticed.
Right. And this, like, I absolutely agree with you. It's the small steps that we are looking at, lah. And we have to be very patient with ourselves. And also, I think family members, caregivers, and even friends also have to be very patient, lah. We tend to have always say this, ah, yeah, only half an hour, ah. Or, and yeah, so like,
Trying to minimize their effort,
that's
minimize the
right, that's
outcome,
right.
and try to get away that little bit of pride that they can have.
Yeah.
You know, so I think that's not so healthy. And then, okay, I'm not so good with SFBT. I used to love it, but these days I've learned so much that it's become somewhere in the back of my mind. But when I think about SFBT, I keep thinking that it's a dispositional sort of therapy. You change your disposition from being problem focused to now
Solution
being
first.
solution focused and being more grateful for all the small baby steps of
Mm.
success. Am I right or wrong?
Yeah, yeah. We always look at the small little steps that we want to take first. I mean, if I may just say from this particular client that I worked with, yeah, she used to sleep at 6 a.m. and then she'll sleep all the way until maybe 3 p.m. or 4 p.m. And we work towards the idea of her, instead of asking her to sleep half an hour earlier or 1 hour earlier, yeah, we work towards the for her to think, if she could wake up like maybe instead of 3 p.m. or 4 p.m., can she wake up like maybe at 1 p.m. So at least when she wakes up, she's in the day, and not towards the end of the day.
So,
Yeah.
what are some small signs that she would notice when she wakes up to tell her that a miracle has happened?
Well, I mean, like for example, I mean, a simple thing lah, very
Mm,
basic thing would be like, okay, when she wakes up at 1 p.m., she has a little bit more time to meet up with some of her friends in school. Yeah, so at least she could come down to uni, where I was working before, at maybe 3 p.m. Yeah, she could attend tutorials or lectures to get into the rhythm of studying, which are at maybe 4 p.m. or maybe 5 p.m.
mm,
Yeah. So to her, when this slowly, and also this would also help her to also get into not just the rhythm of studying, but basically get an opportunities to not the time to actually sort of meet up with friends, and get into some sense of normalcy, right?
mm,
And that's what we are also looking at, and that gives them the confidence. Hey, I can do it. So
mm,
when we ask the question, what's better? What has been different for you? Or, how was that possible?
mm.
What gave you that ability? And so on and so forth. These are all strength-based questions.
Yes, yes.
Yeah, you know what I mean?
I know, I know, I know. I think
Always look at,
mm,
yeah, we
quite
don't
different
look,
from
yeah.
yeah.
Because if we talk about the weaknesses of the person, oh, you have insomnia, why are you sleeping so late? And so on and so forth. I mean, the client really knows that now.
Mm,
I didn't come here to hear or mirror, or for you as a therapist or counselor, right? To mirror me now. I already know that I'm sleeping late. I already know that I've been called a lazy bum, for example, right?
mm,
And that's the saddest thing, right?
mm.
Family members will say, you're so lazy, you're useless, you're this, you're that. But they fail to realize that actually it takes that small steps. And that's the wonderful thing about the what do you call this, about SFPT lah.
Okay.
Okay, maybe I can give an analogy. I don't know if you have seen this before. If you look at it's like you look at a piece of concrete, right? Like a
Yes.
basketball court. Let's say, can you just imagine a basketball court, and it's been there for many years, right? In between the basketball court, as time goes by, there are little tiny cracks, and then in between, sometimes these tiny little cracks are little plants that grow. I don't know if you have seen this before, lah.
Yes, yes, I have, I have.
Ah, so that's what I would like to look at changes, lah. The little tiny plants that grow in between our challenging situations. And that's the hope, actually, that we are looking at.
Gosh,
Even
that's like such a beautiful metaphor. I'm feeling quite moved right now. Like how can this small plant grow in such an arid environment in between two slabs of concrete?
yeah,
A
exactly.
crack that shouldn't even be there.
Yeah.
So tell me more about this, build on this metaphor.
Well, I mean, basically, so from there, from the little plants that you grow, and where was it possible for you to grow and slowly, allow this change in behavior develop, basically, into something that helps the person to realize that despite the fact that I have that he or she has been in that state of mind, how they can slowly progress. But the thing is that sometimes the therapist needs to also, in a way, sort of highlight to them, give them that sense that, oh, that's awesome, for example. So for this particular client, maybe I could just call her Jane lah. Huh?
Okay, okay.
So Jane basically, was having trouble with her studies, and then she was not able to sleep at night. So she would sleep, like I said, at 6 a.m. And then sometimes she'll wake up at 5 p.m., 6 p.m. By that time, the day is all gone. And so that puts her into a depressive mode as well, right? Because, I mean, it's 5 p.m., 6 p.m., I don't think you can meet your friends or do anything really, maybe just go out, and then can you imagine, that, okay, the whole night I'm going to be alone because I won't be able to sleep, right? I'll sleep again at 6 a.m. Wow. So how do you break out of that cycle? Lah? So like we used to work together and say, is it possible for you then to consider looking at waking up at maybe 3 p.m., or 4 p.m. So at least you have that 2 hour gap, and eventually, we move upwards. And by waking up a little bit earlier, of course, common sense lah, Jane would be able to sleep earlier, right? You get tired a little bit earlier, and so on and so forth. But the root cause of all this primarily is it's the anxiety. Yeah, in Jane's case, the anxiety with in from coming from her studies, from academics, the anxiety of fitting into uni life, for example. Yeah, like I need to be like part of the group, part of the gang, that kind of stuff. So the root cause is the anxiety of who am I. So again, it comes down to the understanding your values, your strengths, your beliefs lah.
So,
Yeah.
what is one key thing that you learn from working with Jane? Because every single client is like a teacher to us. So, what is one thing that Jane taught you through your time working with her?
I think one of the clear things that came out was that nothing is impossible. I mean, can you imagine when I first heard, I mean, I'm human, right? When she told me that she sleeps at 6 a.m. and wakes up at about 5, 6 p.m., sometimes even 7 p.m., right? It's like, okay, wow. I've heard of clients having serious sleeping problems, but they sleep at 2 a.m., 3 a.m. the most, and then that's it, and then they're up the next day by 11 a.m., or maybe 12 p.m., but for Jane's case, it was very, very challenging.
And how
So
was what's the outcome? Did she get okay, I hate to use the word cured, but was she cured? Did she manage to reverse the sleep wake cycle back to normal after having some therapy?
yes, almost. She was eventually able to wake up. I mean, we worked backwards, so she was able to finally get up at about 11 a.m. In fact, once I was so surprised, because usually, I mean, in those days, I can only see her at 8 p.m., right? Because she's up only at that time, right? Like 5 p.m. or 6 p.m. So one day I challenged, after a while, I said, how about if I see you the next day or the next week at maybe 11 a.m.? Yeah. So I was thinking that, okay, maybe she may not be able to come, but I just want to put that little challenge onto her. And not and then when I called her at 10 a.m., I say, are you on your way? She says, I'm already in school.
Wow, that's impressive.
Yeah.
Okay,
Yeah.
there's one
So
question I was just thinking, what's the strength within Jane that helped her to change and to get what she wanted? What was that strength? I'm sure you've spoken to her so many hours, you know. What is this
yeah.
special thing about Jane that helped her to get better?
I think, well, there's so many other factors. Yeah. But the one crucial point is for her to see that she has the ability to make the little changes. And of course, she sees the result for herself. Lah.
Okay, which
But
means
that's what she wants actually in the
her
end. Yeah.
mindset is her strength. The
Mm.
positive thinking, okay, I hate to use the word positive thinking, it might have a negative undertone, but it's the ability to trust in baby steps and that she can change if she wants to. This internal locus of control, that was the strength that really helped her.
Yeah, you can say that, Denise.
Nice. Okay, I'm going to go on a
But
tangent
also, I
and
must say that it's not easy. Yeah.
Mhm.
And I think the other factor I would say is the thing that for us, right, what we bring to the table for our clients is that we see things differently. You
so,
know,
mm,
we don't look at her, or I didn't look at her as someone being irresponsible, someone who is lazy, someone who basically, like in a local term we like to use, cannot make it.
mm.
No such thing, because I asked her this question, the very fact, because she felt that way. Yeah, she felt that way. I don't blame her parents, yeah, because naturally as parents, they feel angry about the fact that, you're doing so well, you're in uni and you're studying one of the most difficult courses, but hey, look at you now, you're sleeping the whole day, blah, 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 and so on. You see, but the thing is that so that's what we bring, we be in their
How do
presence.
you look at her? In your eyes, what do you see? Instead of a lazy bum that cannot make it, what do you see in Jane?
Oh, the very fact in Jane, basically, I mean, like any other student, I always believe that the very fact that you could. So the question in SFBT would be, all these years that you have been studying, that you have taken exams, whether from primary school all the way to your A levels or poly diploma or your senior high school diploma. What has worked for you? Something must have worked for you that you eventually reach and have made it to uni, right? For
Mm.
example, in this particular case, of course, it can be other things as well. So what has worked for you? So that gets her or got her. And with this question, a lot of clients start to think, yeah, what actually has worked for me? Something must have been working for me, right? So there must have been a so-called formula, right?
Yes.
That, hey, no, I'm here, that kind of thing.
So what you're saying is that you can see using your lenses, SFBT or therapist lens, that you can see there's some strengths in her that has worked in the past and that it possibly can work. It's just that she's not pulling it out. So you ask the right questions to elicit that.
Yes, then they start thinking about this. So that gives them a little sense of a glimmer of hope, lah. That hey, all is not so bad.
What does hope mean to you?
Hmm. Hope is a four-letter powerful word. Yeah, it is something that we are all looking for. Hope, especially in dire consequences that we are in. Hope to me is like having that the sense that there is a little light, a little light at the end of the tunnel, a glimmer of hope. That's why I like to use the word a glimmer of hope. Yeah.
So for let's say there is a viewer here today that cannot see that glimmer of hope. What is one word that you want to offer her, or like one question that you want to ask?
Oh, well, I would say, like, for example, like I would ask the client, like, what is your best hope for today? Or a simple question which we always ask, like, Denise, right? What
Mhm.
brought you here today? That in itself is hope.
That's right.
The very fact that the client can actually, travel from home to the therapist's office, or at least agree to go on Zoom, or that kind of thing. That in itself is they're looking for hope. So that is the hope itself.
Or maybe you could say that they have hope. They hope that therapy can work. That's why they're here,
Mm-hmm.
right?
Absolutely, yeah, definitely, yeah.
So, okay, just to bring this to a close, I got this curious question that I've been thinking about for some time. Like, why do you choose the name Get a Grip for your private practice? What does Get a Grip mean?
Well, I strongly believe that everyone has the innate ability, right, to change. The question is, how do you go about it? You need someone to help you with that, to facilitate. through our therapeutic evidence-based techniques, and also get a grip, get a grip of something, hold on to something.
So what would you say to someone who has no grip right now and is feeling quite lost? What's one word of encouragement you want to tell that person?
Oh, well, I would say, there's always something that you need to find to hold on to. It is right there sometimes in front of you. Yeah, but we don't know, or we choose not to know, or we choose not to see. So you hold on to that.
Is it okay if I ask you a personal question?
Sure.
What are you holding on to now in the midst of life and our typical life challenges? What is the thing that you're gripping onto?
Wow, that's a very powerful question, Denise. Well, what I'm holding on to is um the love of mankind. Yeah, because someone once told me that if you want to be in this line of work, whether you're a nurse, whether you're a special education teacher, occupational therapist, or and so on and so forth. Yeah, you need to have. You can have all the certificates and all the skills, but if you do not have the love of mankind, then you're in the wrong profession, lah.
I think
So,
that's beautifully put. That's beautifully put. So, okay, guys, that's the end of today's video. I'm going to leave Martin's contacts right at the description below. So he is also looking out for clients, although you need to contact him quickly so that you can get a slot.
mm,
And I'll just leave his contacts at the description below. He's very experienced, and as you can see, a very gentle person and very compassionate and empathetic, and he has a love for mankind. So I highly recommend finding him if you sense that there's some difficulties in your life right now, of which talking to a therapist might help. So Martin, anything you want to tell everyone before we close this?
well, I would say don't lose hope. Yeah, I know times are very difficult with inflation costs coming up. Like I think I read somewhere or watched some video where they say it's the perfect storm right now in our world. But yeah, we are here. If you find that you need to speak to a counselor, I think Denise runs Lid Hops Counseling, right?
That's right. That's right.
And myself, yeah, approach a counselor, therapist. It's not difficult. Yeah, just give us a call or drop us an email or WhatsApp. Yeah,
Awesome. Awesome.
yeah.
Thank you so much. So
Thanks.
thank you everyone. If you like this video, kindly press subscribe, share it with your friends and press like. Thank you so much.